I was part of the committee who made the proposal for the first plan cancer. So in France, there is mainly a plan cancer and nothing else as far as health is concerned. There is not things as strongly devoted for Alzheimer or other diseases. Why? Because cancer is a model disease. And what France wants to do is to really have a strong cancer program and make sure that all what we learn from cancer will apply to other diseases. So the cancer plan is important for cancer, but it's important in France to make sure that the improvement in health issues are developed taking as a model cancer. The disease for which in the next 15 years there would be the majority of new drugs, there would be personalized medicine, so you will have to have the associated tests, whether we can afford to pay for the drug, But it's also the question of now integration between research and healthcare, and whether it's improved quality or not. It's the relation between highly sophisticated center and general practitioner, so what we say the city and the big university hospital, this connection. How many center you need, what if you want to have equity in health access, you need to have locally, or whether you have to have access in 3 steps to the best and not lose a chance, whether you have no connection or no, you are not a wealthy person, so everybody has to have the same chance. Cancer is a model. What was the idea of the cancer report? The idea in the Plan Cancer was to hook research to treatment. Why? Because we know that the quality of treatment is also dependent to the link between research. First point. Second, if you want to develop a link between basic research, technology, and clinical research, you have to organize yourself in such a big setting, because otherwise, each time you launch a program, you propose money, there's competition between centers which are close by, and you don't have really a setting which is organized. So in France, we have 45% of the research potential which is in Paris area. If we want to be competitive, we consider that, especially at the European level or international level, none of the region in terms of organization of research related to health system has to have less than 10% of the French potential. And nobody has to be excluded. So the proposal I made in the first cancer plan is to organize the research, not only the basic research, the clinical research and related to the hospital, in territories. None of them having less than 10% of the French potential. We end up, that was a top-down, but then there was a proposal which was bottom-up, so that the region organize themselves as they want, as they wish, and we have 7 cancer reports. The 7 cancer reports has to have their own program, which means that if you have to have heavy equipment, you will not have 3 or 5, it's only 1 is needed in a region. It means also that the local authority now considers that if they invest in health, especially in the field of cancer, they know that it's well organized. It's a better relation now between university, basic research institute, technology institute, and the access to the clinical research. It's also interesting for the company, or small or big, because they know that if they want to have a program, they go to the cancer report and they will immediately go to the best people they could interact with. So I think this type of organization now is interesting, and in France we have an organization of health which is also organized by territories, slightly smaller than the 7 cancer report, but they use the cancer report as a model and try to consider now for other diseases to organize such territories.
And you are going to be hosting the UICC conference. Tell us about that.
Oh.
When is it and what is it all about?
So it's in 2016, it's end of October, beginning of November 2016, we will be in Paris not only for the World Cancer Congress, but also for the summit. So I'm working hard, even during this meeting, to make sure that our partner, the new European board member, because it's not only France, it's Europe. You know, we have two now, UK with Kumar and Richard Sullivan and Annalise from Norway. So we want to make a big project. So first, I'm happy that it's back in France, because France was at the origin. You know, we have many things. We have Marie Curie, but we have also, as far as UICC is concerned, Pierre Lenoir with the TNM classification. But we have also Gustave Roussy, who created UICC. And as you say, we just have cancer plans, and so we want to go and to follow what UICC has been building with the summit and the Congress, and take the opportunity to go to Europe, especially in Paris, and to develop a new program and make promotion of the action which are done by UICC in the field of non-communicable diseases. The link with IRC, also another French initiative with General de Gaulle and Dacier de la Vigerie. And it will be in 2016 the 50th anniversary of the creation of IRC. And there will be also events at this occasion. And we would like also to have a big debate, I think, on new technology and tobacco control.